Welcome to Systems Change and Systems Thinking in Public Health. In this video, we are diving into systems change from a public health lens, what it means, why it matters, and how we can approach today's public health challenges with systems thinking. Understanding these concepts matters because how we define and respond to challenges shapes whether we address only symptoms or actually make deeper, lasting change for health equity. So, why do we need to focus on systems change? Public health leaders increasingly recognize that we cannot improve health outcomes without addressing the systems that produce them. Today's public health problems, such as chronic disease, addiction, homelessness, climate impacts, are complex. One way of illustrating this complexity is with a tree metaphor. On top, we see the leaves of the tree as the visible and complex health problems, with the branches showing what leads to these outcomes. The trunk represents social determinants of health: education, housing, food access, etc. But deeper still are the roots: systematic issues such as poverty, racism, classism, and structural inequities that shape and sustain what we see above the surface. These root causes are connected to ways of thinking and living that have been reinforced for a long time, often by those in power and positions to set the rules and policies. Surrounding the roots, then, we find the soil, the culture, mental models, and power structures that reinforce these root causes. Systems change is about going beneath the surface, not just pruning the branches, but transforming the soil, our norms, values, policies, and mental models that nurture inequity. If we don't address these old ways of being, change doesn't occur. Systems change is defined as a set of actions that fundamentally shift the conditions which are holding the problem in place. It is a deliberate process to shift the structures, relationships, and beliefs that hold current conditions in place. From a public health perspective, systems change means moving beyond programs or individual behavior change. It means rethinking how we work, how we engage, and how we create shared understandings of the root causes of the health outcomes we aim to improve. Systems change involves deep shifts in mental models, relationships, and taken for granted ways of operating, as much as it involves shifts in organizational roles and formal structures. The Academy for Systems Change. Systems change is a deliberate process designed to transform the system's fundamental behaviors so that a new, sustainable pattern can emerge. Forum Systems Innovation Lab. Systems change can happen at multiple levels. At the organizational level, it may involve transforming how local health department policies and practices foster a workplace culture where all staff can thrive. At the community level, it can look like multi-sector coalitions, shifting how schools, housing authorities, and healthcare providers coordinate to address food insecurity. At the structural level, it could include national policies that redefine access to care and public health funding structures. Such shifts won't happen in isolation and will require aligned efforts across people, policies, practices, and power structures. It would involve addressing power, equity, and the structural and cultural conditions that shape community health. Mental models play a central role in this work. They are the deeply held beliefs, assumptions, and narratives we carry about how the world works. Peter Senge describes mental models as deeply ingrained generalizations that influence how we understand the world and how we take action. They shape everything from our daily decisions to institutional policies. Changing mental models is slow and often invisible, but it is foundational to systems change. As Albert Einstein famously said, we cannot solve problems with the same thinking that created them. Without these shifts in perspective and meaning making, even the best intentioned policy and program reforms will struggle to take root and endure. Building on the tree metaphor, being able to see the forest and the trees and the stream and the rocks and the roots requires us to be systems thinkers. The art of systems thinking lies in seeing through complexity to the underlying structures generating change. Peter Senge. So we've talked about systems change, but what is systems thinking as a practice? Systems thinking is about understanding how elements are connected, how feedback loops operate, and how patterns emerge over time. While there is no single definition, there are several key concepts. First, a commitment to learning and inquiry. This means embracing curiosity, asking why, and adopting a what if mindset. Second, it means seeking out different perspectives that may challenge our own thinking or deepen our understanding of an issue. Third, it's seeing the connections within a system that help us to understand the resource flows and relationships and power. Seeing these connections help us identify leverage points and opportunities for change. Fourth, systems thinking is about distinguishing between technical and adaptive aspects of complex challenges and looking beyond the obvious issues for the root causes. And lastly, it's about seeing the pieces within the whole. This helps us resist the urge to jump to solutions and instead work with others to understand deeper dynamics. In systems thinking, it's critical to distinguish between technical and adaptive challenges. Technical challenges are those that have known solutions, even for complicated issues. For example, if a health department is experiencing a staffing shortage, a technical approach may involve updating job postings to ensure they appeal to wide audiences who may have the necessary skills. It's not to say technical fixes are easy, but there are clear routes to the solution. However, these solutions often do not address a root cause issue. On the other end of the spectrum, and it is a spectrum, adaptive challenges are messy and complex. These include challenges such as poverty, racism, lack of education, and unequal access to healthcare. These are at the root of the health issues we are trying to address. They require shifts in values, relationships, and mental models. For example, if a community doesn't access care because of a long history of discrimination and medical mistrust, the solution isn't just expanded clinic hours. It requires building trust, addressing historical harms, and co-creating culturally grounded approaches to care. So these adaptive challenges are big and require systems thinking and systems change. It's critical that we diagnose challenges correctly. Mistaking an adaptive challenge for a technical one means we risk offering surface level solutions that don't address the root issue. Let's look at two more examples. An example for a technical challenge may be a local public health department lacks sufficient data sharing infrastructure across its programs. Staff know what data they need, but systems aren't connected. The response may be to procure and implement an integrated data platform, train staff, and assign data stewards. While the solution may not be easy and would require time and resources, there are clear roles, known tools, and measurable goals. An example for an adaptive challenge may be in the same department, program leads resist sharing data because they are already overstretched. They fear new expectations will add to their workload without additional support or time. A response to this may be this requires adaptive leadership, honest dialogues, relationship building, surfacing fears, and co creating strategies that acknowledge real capacity constraints and promote a sustainable, collaborative data culture. Both challenges exist in the same context. Addressing one without the other would limit impact. This concludes our foundational video on systems change and systems thinking in public health. To learn more, we encourage you to explore the Public Health Training Center Network's Learning Agenda for Systems Change Toolkit,